Hi everyone, I'm your fave Nurse B. Welcome back to Nursemas. Today is Nursemas Day 6. I'm super excited. We are halfway through this. I've been consistently uploading videos every single day, and I'm going to continue to do it for the next 6 days all the way up until Christmas. Remember, I have giveaways you can enter all the way up until the 24th at like 11:59 Central Standard Time. Some of the giveaways are announced, some of them are in the actual videos. You have to watch the videos and find them, and also follow me on all my social media platforms, and that way you'll be able to see all of the giveaways. Okay, so before we get into the video real quick, I just want to thank everybody who has taken the time to donate to my PayPal account. Yes, I do have a PayPal account. Basically, I talked about it in my last video where I was showing you all like how I'm a mom, a wife, a YouTuber, and a nurse, like how I incorporate that and like create a routine for myself and like just get things pretty much done. I talked about how I was kind of apprehensive about doing PayPal, but I was like, you know what, if I can get half my subscribers to just give $1, that will definitely help me to go back to school, because some of you may or may not know I owe a school money and they will not release my transcripts. Thus I cannot go back and get my RN yet, even though I've done all my prereqs and everything. Like, I have to get those freaking transcripts released. So if half of the subscribers that I have can contribute $1, that will pay towards my debt, and your girl will be back in school to become an RN. Like, and I'm just so grateful for everybody that like freaking donated, because a lot more people donated. Some people gave $1, some people gave more than $1. Like, so I'm just so grateful. But if you're not able to donate, you can always just like my videos, share them with other people, watch my videos, watch my old videos, comment on my old videos. Like I said, if you're in nursing school, share it to people in nursing school. If you work at a facility that, you know, people want to go into nursing, they're interested, share with people that you know. Like, just let it out there. Let your fave nurse be known to people in your life, and that's just right there that really helps me. For you all subscribing, liking, commenting, and sharing has gotten me to where I'm at right now. So I'm super grateful. But if you are willing to donate, just go ahead and go on my PayPal account, and like I said, just donate $1 or more if you want to, and then it will really help me. Like, I know it's all gonna happen. I know everything is coming to fruition. I feel so good about so much stuff. But let's get into this video. You know, pregnancy hormones, I mess around and start crying. Okay, I ain't got time for that. I want to talk to you all about a DM I got from someone. I'm not gonna say your name, but I appreciate you DMing me about this subject, because I didn't realize like how important this subject was, and I really want to get it out there to people. So basically, she was telling me that the school she attends to is not that well, and she's just trying her best to pass her classes so that she can pass NCLEX and become a nurse. And she was saying like the thing that she's having an issue with is like she feels like she's not competent when it comes to her clinical skills as far as doing trachs and wounds, probably doing like Foley care as well, or G-tube. I'm not sure if she's done that. She didn't mention that, but she mostly talked about wounds and trach care. And she was just like, you know, she talked about ostomies too. She was just like, how is it going to be when you get out of school? Like, how much does your employer expect you to know? All right, y'all, sorry, I was really interrupted by my husband. But she was basically saying like she just feels like she's going to get out of school and not know what the heck to do, and she's going to go to an employer and they're going to be like, why don't you know this? I think that's kind of like where she was getting at, as far as like her fears and apprehensions about what is the employer really going to expect of her as a new nurse. Now, from my experience, whenever I train new nurses, I really take the time to go through and be like, hey, do you feel comfortable doing this? Can you do that? I expect you to know like how to do blood sugars and how to read orders and comprehend those orders and be able to carry out those orders. So example, if something says cleanse wound to coccyx with normal saline, apply Santal and dry dressing daily in PRN, I expect you to know that you go in there, you know where their coccyx is, you get them on the bed or they're already in the bed, you take their brief off or underwear, whatever, you turn them, you take off the old wound, change gloves type of deal, clean it off, change gloves, whatever. Like, you need to know like the actual technical way of carrying out all these clinical procedures. So yeah, I expect you to go in there, do that, have all your equipment ready, have your stencil ready, have your normal saline, have your gauze, your 4x4, your adhesive, have all that together, you know, and be able to carry out that order. Now, some new nurses, they might not know how to use certain like tape. Like there's something called OmniFix. When I say these different terms, let me know if this is what they call it at your facility, because hospitals, nursing homes, different nursing, like everybody got like completely different freaking names for the exact same stuff. So OmniFix is like that kind of stretchy, like gauze like tape. It's like gauze material, but it has adhesive on the other side of it, but it kind of stretches like a gauze. So I expect you, you know, I don't expect you to know exactly what everything is, but I expect you to be like able to do it. Like you see an order and you like, okay, I know where the coccyx is. I know that I gotta find Santal, whatever that is. You might not know exactly what Santal is. I didn't know what the heck Santal was when I was in nursing school, but okay, I know, okay, I read the order, that must be something I gotta put on their wound, right? Okay, so I don't expect you to know exactly how to put it on there. Like, that's what orientation should help you to do, especially as a new nurse. At least with me, when I'm orientating a new nurse, like, I kind of be like, try to get a feel for that person and see what they know. If you come and just be honest and be like, hey, I'm not saying go to your preceptor, which is the person whose orientation, be like, hey, I don't know nothing, girl. Like, you gotta show me everything. I don't expect you to do that, but if you don't understand it, like, I expect you to say something, or to ask questions. Some people, there's some nurses who have been nurses for like 6, maybe 8 months, who'd be like, I don't know how to do a suprapubic, you know, like, can you come over here and help me? I'll come and do it. Like, it's not, I will not do it. I'll come and show them, because you don't always see that in nursing school. And that's like one of the biggest downfalls, I feel like, in nursing school, that clinical sites like really suck. But I can understand like you coming out feeling like, how the heck am I going to do this? You know? So it really, like I said, I didn't say this, but it really depends on the facility you go to and whoever is training you. All I can say is that you need to come out as confident as possible. They know you're a new nurse, so you really don't, they know how it is coming out of nursing school. Some people will actually be nice and understanding of that. Some people won't. This is why a lot of people say you should become a CNA before you become a nurse, which I will do a video about that, y'all. But because you're already in that setting, but take the time. Whatever you're not feeling confident about, you need to read. Get your freaking Fundamentals of Nursing book, which I'm about to show you real quick. You know those little like skills that they have, kind of, let me see, let me find some. It'd be like a checklist of stuff that you need to do. Boom, ostomy care. So this is my old Fundamentals of Nursing book, and I just flip to ostomy care. This is what it looks like, and you read that, and it shows you exactly how you're supposed to, you know, change ostomies. Does it show you how to change it? Let me look. I could just be talking. Let me see. It shows you about your assessment. So assessing the actual stoma and then the skin around the stoma, any type of pain, any type of drainage. Yes, here's the step-by-step changing of the ostomy and caring for it and cleaning out the freaking bags. So yeah, I expect you, if you feel like your school is crappy when it comes to clinicals, and maybe you don't have that background knowledge of being a CNA. Like when I was a CNA, I changed colostomy bags and I emptied them and learned all that on the job. So going into, like, I didn't learn it. Literally, we never dealt with ostomies in nursing school. I don't even remember learning about them. I mean, I learned like where you could have like different bowel resections and things like that, and end up having ostomies and things like that, or ileostomies or urostomies. I learned about that, but actually taking care of it, can't remember learning anything about it, which is weird now that I think about it. But I saw it so much as a CNA. So I expect you, if you don't have that background knowledge, I expect you to definitely read through these type of checklists, get an idea of it. When you go to a clinical site, go to the this is why I only have one video, 1 or 2 talking about clinicals. Go watch those videos, y'all. This is why when you're in that setting, you need to be like really kind of assertive and be like, hey, do you have this? Can you show me that? Da 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 da. I know some schools, like, you can't even do anything without your instructor next to you, which is like, how the hell how you don't get anything done? It's like 20 students and one instructor, and the instructor got to be with you the whole time. Like, you're not gonna get nothing done. But I know whenever I used to see students, I'm like, hey, come with me, I want to show you something, that type of thing. Or if I'm working somewhere and I'm working with a person who's in nursing school, like a CNA, I'll be like, hey, do you want to come do you want me to show you how to do this IV, or do you want to come in here while I do the IV? And I kind of talk them through it. Not everybody is like that. Not everyone has the opportunity to have somebody who can show them things while they're in nursing school. But if you can, try to get out there and get as much help while you're on a clinical site, which I know can be hard. Like I said, some schools are just flat out stupid when it comes to clinicals. But if you feel like you don't have that type of skill set, read. If you don't know how to do it physically, if you haven't seen it physically, then you need to understand how to do it when it comes to the book. Do you get what I'm saying? Like, if you don't have the actual physical clinical smarts, you need to have the book smarts. So you need to understand what NCLEX wants me to do. You need to understand, okay, I've never done a freaking Foley. I've never given anybody a dang on catheter, but at least I know that, okay, I need to be sterile. I need to, you know, put on gloves and go in there and look at them, see what they got going on. Take those gloves off, wash my hands, and then open up the container, and then take the gloves out. This has a sterile technique. This and that. Explains to the patient what I'm doing. Yada yada yada. Have a dirty hand, have a clean hand. Like, you need to understand the steps that it takes. You may have not done it, but I need for you to read that book and get an understanding of it, which can be hard. The best way to learn stuff like that when you aren't actually doing it is to read it, and then, like, after you read through it and kind of feel like you have an understanding, close the book, close your eyes, whatever the case may be, and just sit there and say out loud all the steps over and over again to yourself. You get to a part where you be like, and then and you kind of forget. Go back to your notes, look over your notes, and look over your book, and then come back and keep going through the rest of the process and picture yourself doing it. Talking yourself through it really helps. And of course, there's plenty of videos here on YouTube that actually shows, like, schools that have like a little, you know, mannequin or dummy or whatever, who is they're performing like different tasks on these patients. So use your resources. Do not be discouraged. I know some schools flat out suck. I'm learning that that's pretty much the case in all nursing programs. Like, everybody has telling me, like, all this stuff about their nursing schools, and it's just, I'm like, why? Like, why do all these schools suck? Like, how do you expect people want to be in this career? But if, I just want you to know, going into a nursing home, there may be a time that they have you on orientation. They say, we're going to orientate you for 2 weeks. Okay. Maybe halfway through that, they're running short on staff. It's you, and they're like, hey, you know, you want to work the floor by yourself? You feel comfortable working the floor? If you don't feel comfortable, I need for you to be like, no, I don't feel comfortable. And leave it at that. You're a new nurse, brand new. Now it's all on you. You have no instructor and no school to fall back on. It's all on you. So whatever happens falls on you. They expect you to be competent enough and to be adult enough to say, I cannot do it. I will not do it. You get what I'm saying? Because if something happens, it falls on you, and that's your license. That's your time, your money, everything. So you definitely need to protect it. So that's my advice in that situation. She did bring up something else. I was asking her, like, you feeling like you're not able, like you don't really know that much. Is that you, or is it everybody? Because I wanted to kind of get an idea. Was it like her having anxiety type of deal? Or was it like the school just really does suck? Everybody is just like, what the heck? So she was saying like it was everybody. And she wanted to know, she was saying like she learned trach care once and then that was it. In my nursing school, it was the same thing. We saw one trach. This was early in fundamentals. We saw a trach patient, and that was, fundamentals was probably like July, August maybe, and we graduated that next March, and that was the only time I saw trach. Trying to think. I think that was the only time I saw trach. So that was that. That was my experience. And coming out of nursing school, going into a facility, I had a trach patient. Well, a patient that had a trach, I should say. And I remember, I told y'all about this. where I was in a room with the CNA. The nurse wasn't on the floor. It was like maybe my first, I think it was like my first day of orientation, and we was in there changing the resident, and I'm looking at the resident. She's just like in so much like evident freaking respiratory distress, and I'm like, oh, okay. What do I do? And the CNA was like, I don't think she don't look right. She breathing hard. And I was like, she is breathing hard. And you know, you kind of feel like stupid, like, oh my gosh, I'm supposed to be the nurse, like I'm supposed to know what to do, but you ain't gonna know what to do. You're a new nurse, like you just not gonna know. But I was like, this ain't right. Her respiration was like probably in the 40s. So I found the other nurse. She walked off the floor to go do something. She was by herself with like 60 patients. So I found her, and she came over there, and come to find out, her trach, like part of it started coming out. And so she had to like fix it and, you know, make sure that the trach ties were actually tight enough and snug enough around her neck, because the lady would cough a lot. So, and they kind of pushed the trach out a little bit, the actual container. You know what I'm talking about. It pushed it out a little bit. So she was able to push it back in and kind of tighten up the trach ties and make sure it was snug and it stayed put, even though she was coughing and kind of moving a little bit. But I was like, oh my gosh, I can't believe I didn't know what to do. Like, I feel like, my goodness. She was like, well, at least you knew to ask for help. You know, at least you know to ask for help. And I talk about in my video top things that you should master before getting out of nursing school or graduating from nursing school. Go watch that video if you all feel some type of way about, oh my gosh, what am I going to do when I graduate? Go watch that video like now, after you watch this. And like, comment, and subscribe, please, and share. So anyway, she was like, at least you knew. So that's one thing. Like, that's why I say you need to understand the book. Because had I not known that 40 respirations is not normal, even if you got a trach and you got oxygen and all that, it's not normal. Had I not like paid attention to my CNA, who was looking at me like, girl, this ain't right. Had I just been like, I'm the nurse, you don't tell me what to do, da 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 da, and walked away from the situation, that person could have, who knows what could have happened to that patient, you know? So no, you need to know your book and focus on the positive. Like I always say in all my videos, you know, just focus on the positive, focus on what you know, be humble, ask for help, know when to ask for help, and just know when you get out of school, you're not going to know anything, y'all. When I remember one of my first days of orientation, a patient had like a temp, and I think I talked about this in the video too, and I was like, okay, they got a temp, what the heck do we do next? He's like, the nurse was like, okay, we're gonna get us some Tylenol and monitor them, da da da. I was like, oh yeah, Tylenol. I was like, what the heck? Like, why did I think about that? I didn't even think about that, y'all. Like, I was just like lost, completely lost. And this was me. I was already a CNA, had already worked at this facility, had already been around these nurses, but my mind had to shift into I am a nurse now. And that transition alone of shifting your mind from where you were at as a student, oh la 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 la, like I'm a student, we could do this, we could do that, to like the actual real world of, okay, this is what we're actually doing, not what we could do, but this is what we're doing. It takes some time to transition. As long as you stay humble and you stay open-minded and you ask for help, you should be okay. If you're in a situation where you feel like everything is being thrown on you, you feel uncomfortable, you feel like you cannot grow, and you feel like your license is at stake, you need to get out. There's plenty of nursing jobs out here. You do not have to be pressed for anybody's nursing job. So there's plenty of opportunities out here. You need to protect your license and protect your patients, you know, because that's what you went to school for, to take care of people, not to harm people. So you want to make sure you're in the best position. So I hope that this helps the young lady. Thanks again for DMing me on Instagram. If you all are interested in if you all are interested in any type of video request, or you have questions for me, make sure you DM me on Instagram, or you can also email me. Facebook is not the best place. I really don't like doing Facebook messaging. So Instagram at YourFavNurseB #1, and then YourFavNurseB@gmail.com is my email address. Any other information that you need is in the description box. Like I said, my PayPal account, if you all are interested in donating to the channel, is in the description box. So yeah, like, comment, and subscribe. Make sure that you continue through Nursemas. Today is day 6, so we have 6 more days up until Christmas. And yeah, like I said, there are some giveaways, secret giveaways here and there. So make sure you watch all the videos all the way through, and then follow me on all my social media platforms. Thanks for watching. Peace.